You all, just to orient us to why it is we're all gathered here today. Really, this came about with the health equity focus of engaging pregnant and postpartum women in mental health and substance use disorder treatment, specifically focused on Native Hawaiians and other Pacific Islander populations. We're really excited about how this collective effort can move the needle on this particular health priority. And with that, I will hand it over to Melinda at the Center to Advance Consumer Partnership, who will get us kicked off with our research findings.
Great, thanks so much, Carissa, and echo Carissa's thanks for everybody being here, which I believe for those of you in Hawaii, it's only 8 o'clock in the morning. So an early start to your day. So thanks for being with us. And thanks to our MIC partners for really making sure that beneficiary and community voice is a high priority and a key component of this work. We know at CACP from our work across many communities and organizations that the lived experience and the expertise of consumers or beneficiaries is most often the missing link to designing and to implementing programs and services that really work for those who we intend to serve. So we are honored to be in the role of bringing that voice to the table for this work. So our role has been to hear first from organizations in the community and ultimately from beneficiaries themselves about the barriers and the challenges and the opportunities that they see in terms of accessing and receiving really high quality care and service around maternal mental health and substance use. As those of you who are in Hawaii may imagine, building trust and relationship to actually talk story with Native Hawaiian women about mental health and substance use takes time. And we are still actively working to engage directly with pregnant women and new moms. Much of what you're going to hear Heidi talk about today, therefore, comes through the lens of those who are working most closely with women in Hawaii. And it's through these conversations that we are having with local community organizations that we are opening the doors and the opportunity to ultimately be able to talk story directly with some women through some of these organizations. So we feel good and actually had a listening session with community organizations just a couple of days ago in Hawaii, and they validated for us that they feel like we've captured the key themes. And our work over the next few weeks will be to just continue to dive a little more deeply and validate that with as many beneficiaries as we can. With that, I will turn things over to Heidi to share with you what we've learned so far.
Sorry, thank you. Melinda has just really beautifully described the methodology, but just as a reminder, we really began with the help from folks at MedQuest making some suggestions about who we should connect with first to understand the landscape, then connected with community-based organizations and providers that are providing direct care, and recently began having conversations directly with Medicaid beneficiaries. So this really just describes the methodology. I won't spend too much time here. So before I begin talking about the themes, this is a synthesis of each of the 6 major themes describing the barriers or opportunities that are preventing women from getting care or getting quality care or staying in treatment. I just want to say a couple of things. Women in Hawaii, particularly Native Hawaiian women, have been described to us as both the matriarchs and the patriarchs of their families. And mothers in particular have a great responsibility in their families in addition to influence. And mothers are truly central to that family. And this notion of all things moving around mom was very strong and came through in those conversations. So when we share the challenges and barriers that we're about to dive into, the team and the community-based organizations that we've spoken to just ask that you remember the strength of these women and these mothers in particular as we talk about some of the issues that they encounter. So I'm going to, the next few slides, I'm just going to dedicate to each one of those. But before we do, just as a level set or a grounding about the experience for pregnant and newly parenting moms, I just want you to have a sense of what we heard when we asked about what are the common entry points. So it is probably no surprise to this group that women are typically entering the mental health or the substance use recovery system at a point of crisis. Things have gotten to the point where they need help immediately. And that often might mean, a hospital emergency room, an overdose, child protective services has gotten involved. They might be being identified during their maternity care. And then if there have been escalated issues that have resulted in interactions or engagements with police or law enforcement, there might also be courts. And then of course we have people who have self-identified themselves for care and treatment because they need it and want it. And we have others that know that they need help and care, but they are not seeking care. And we're going to talk about some of those reasons. After they enter the system, so to speak, they go through this process of trying to understand what is available to them, what are their benefits, how will it be covered, and they're looking for resources or help to find that out. There's also this sometimes formal, mostly informal assessment that's done about what kind of help, if any, do they have in terms of support with family, particularly if we're talking about women who already have children. Because as you all know, the traveling and getting about to appointments, care, or treatment, or being away from the home takes a significant amount of effort. Then they move into engaging the right providers. So keep in mind, these moms, these women are dealing with all the things that most of us are already dealing with. They want to get regular care in addition to the mental health and substance use or recovery treatment that they might be managing. They might also be managing things for their family, their doctors, the detox, the outpatient, the hospital, but maybe trips to the pharmacy and just that ongoing support. And then the last phase is really to indicate that working with others. So they might be, if there is a probation case that's going on, they might be working with their probation officer. They might be having to have regular check-ins with CPS. They're trying to get their maternal or postpartum care. That's, just regular standard of care for their pregnancy. So keeping in mind all of the other stakeholders that are involved and all of the other visits and interactions that they're having. So hopefully this framework is just a bit grounding as a reminder about where folks are, where they begin, and what they experience as they travel through. And now we're going to take onto the next slide, take you through the first theme. And that is this lack of a unified way to find out what's available to me. And you'll hear me trying to talk here in the voice of these women. I don't know what's available. I don't know how I'm covered. I don't know where to go. I don't know where to begin. And as I previously described, if they are in crisis, it's even that much more complicated to find, to navigate, and to take the time. So where they begin that journey really matters. Mothers and or their babies might be screened during prenatal care or during delivery and test positive for substances. They might be involved with CPS, as we mentioned, but there's no central location for them to turn. And what's really needed here is an understanding, a clear understanding of where do I go when I need help? How do I figure out what kind of help I need? And where do I turn? We do know, and we did hear about the Hawaii Cares Hotline, and certainly when folks know about that and they use it, they will be given the names of some recovery providers or behavioral health providers that accept Medicaid, but they're often left on their own to navigate, which frequently means figuring out how to get around, flying to neighboring islands for treatment, maybe leaving their family behind, which we'll talk about in some additional slides as well. The next theme or insight is around finding providers who take my insurance when I'm ready. So that notion of when I need help, I need it now. And from our community-based providers who are interacting directly with them, when a woman decides that she needs help, it can't wait. And often there are wait times for them to see providers. It's very difficult to travel. And the commitment level or the level of effort that's required to make and keep and travel between islands for things like regular appointments, if they need to go into a detox for some amount of time, if they need to seek ongoing recovery care. Those are not just decisions of I'm going to take a drive and go to an appointment. There's often lots of arrangements that need to be made, and they're just not readily available and not easily accessible. We even heard about providers in some of the under-resourced islands reporting that they're nervous about screening pregnant women for behavioral health or substance use needs because they don't have a place to refer them. So there's a few powerful quotes down in the bottom of the slide that I'll just give you a second to look at in reference to that. And then the next insight and theme is one where we'll spend a few minutes here. As I mentioned at the top of the discussion, mothers are central. In addition, they are usually the primary caregiver in their families, and rarely does a woman experience any behavioral health or substance use issues without it affecting the entire family. And so likewise, it affects that family when she needs help. They're definitely fearful of family separation. There's all of the logistical hardships that we just spoke about, but there's also the financial burden associated with perhaps needing to leave their job to go and get this help, or having to ask a family, if they have it, for support to care for the children while she's gone. There's a lot of shame associated with substance use and addiction, and definitely a tendency to keep and try to solve this within the family. And that will take me on to our next slide, where we're going to spend a moment talking about cultural competency. Folks just simply don't trust, and they really want to interact with providers who understand their cultural beliefs, understand their cultural values. And I think that what we say that the cultural needs are characterized by things like trust, as Melinda mentioned. Time. It takes a significant amount of time to get to a place where women and moms are willing to disclose what's happening. And also the significant importance of ancestral and native practices. Substance use and addiction are definitely perceived as Western issues brought here by colonization. So there's a strong bias against Western people, practices, and these systems of care and the treatments that are built around those systems. And we've heard that providers who are successful in this space are doing a great job of incorporating traditional healing practices into treatment that includes some of those spiritual practices that are grounded in family, which is so important, and the relationship to earth. A couple of examples that are probably familiar to you are Ipono and Ho'oponopono, and as Melinda mentioned, just talk story. There's deep and systemic acknowledgement that when you take care of mom, you take care of the family, and to take care of the family is to take care of mom. So however, the resources that are and the services that are available that are billable for providers is very limited in this space, and that came up a lot amongst the community-based organizations. The next insight and theme in our work is around care avoidance. So for all of the reasons that I just described, it's very easy to not get care and just sort of stay and struggle through those days, or with that addiction, or with that mental health problem. So we've listed here a few for you to look at in terms of what are the drivers, what are the reasons that people are avoiding care. And I think it's worth mentioning, I probably should have said this earlier, that the first experiences that women have in terms of getting help when they're ready to ask for help really are strong indicators of whether or not they will stay with treatment or in recovery. So any bad experiences will definitely lead to falling out. The transportation requirements are huge. The amount of shame and or stress based on, you know, the size of the family and the responsibility of that mom or woman. And the language barriers for some communities of people who just cannot get care and speak their native language. We heard a lot about trauma-informed care, and we spent some time discussing with some of the community-based organizations what that looks like in their practice. And that goes directly to you know, the bad experiences. The folks are really trying to make sure that it is a good experience when help is asked for. There's just not enough of it. And then our last insight is the voice and choice. So I think, like all people, we want to have and be part of the discussion about what happens to us, and not be dictated by the processes, policies, or authorization steps that need to happen. And women are just not feeling heard or part of the discussion. And this statement here, feeling like this process of getting help and care is happening to me as opposed to with me, I think is pretty powerful. And the systems, I think it's important to keep in mind, the systems that we talk about are obviously the healthcare ecosystem that includes behavioral health, that includes substance use. But as I mentioned earlier, there's lots of other systems that they might be required to be navigating, in addition to just, you know, keeping that family together and keeping things functioning day to day. There is, we mentioned the fear about CPS separating their family. So that just leads to keeping things inside and perhaps not sharing it. So they definitely want more choices that are family friendly. And that wraps up all of the key themes.